Okay, so first we're going to start off with our first aid skills test, and the first one is EMS arrives and takes over, so it's safe to remove your gloves. And these are the only gloves I have that I'm going to use to demonstrate. So you're going to pinch the inside right here by the heel of your palm. Slowly drag it down, making sure the glove is inside out. So now the dirtiness is on the inside. Cuff it in the clean one, and you're gonna go under right here, cover that, and slowly pull it once again. Then you have it off. So you're gonna properly dispose of it in a waste bag or trash or anywhere that's safe to throw it. And on to our next thing. Our scenario is you find a coworker laying on the floor in the break room. There's a phone, a first aid kit, and an AED. And then let's go right into it. First, you're gonna assess the scene to make sure it's safe to do what you need to do. You're gonna tap and shout, say, "Hey, are you okay?" and make sure you're loud and clear. And make sure you're tapping them with enough force. And you're gonna shout for help, tell someone to call 911, get the AED, the first aid kit, and then you're gonna check the breathing. And to check the breathing, you watch the chest rise and fall. And if there is no rise or fall, you're gonna do your CPR, which is if they're not breathing CPR, you're gonna do 30 compressions with 2 breaths, 30 to 2. And then while you're checking for breathing, you're gonna check for any other injuries. See if there's any jewelry indicating that they have allergies or they're not supposed to resuscitate or things like that. And then if they are breathing, you're gonna let the person know you're gonna stay with them until EMS arrives. And then so if the person isn't injured and they don't have a medical information jewelry, then you should ask them if they're conscious, if they're allergic to anything, or where they're hurting, just to kind of figure out where or what's wrong with them. And if you're alone, you want to let them know that you're going to go call 911 and go back to them and let them know that they're on their way and you're going to stay with the person. Okay, and let's say somebody has an allergic reaction and they have their EpiPen, they need help using it. And so what you're going to do is, and I'm using my pen to demonstrate, you're going to take off the cap, take it off. You're going to hold it in your fist. Well, first you're gonna hold it in your fist first, and then you're gonna take off the cap. And then you are going to press it firmly on the outside of the thigh for 10 seconds to make sure that medicine gets released. And then you're gonna remove it and massage the area for another 10 seconds. And you should stay with the person while you're doing that. And then for bleeding and bandaging, to stop bleeding, you should tell the person, first figure out where the bleeding is coming from. Then you're going to grab some bandage and put it on the area, putting pressure on it. Tell the person to put pressure on it. And then you're going to put on your gloves. That way you're not at risk for getting a disease or spreading any infections. And then you're going to apply the pressure to the bleeding area. And if it's not stopping, you're going to keep adding on your bandages and dressings and press harder until it stops bleeding. And then if it has stopped, you're going to keep that pressure, hopefully, and then call 911. If it's very severe. If it's not super severe, then medical assistance might not be necessary.